This week on LTC News, an update from the school department.
There's two aspects of this. There's the physical safety, and then there's also the psychological safety.
Dismantling the Lord Overpass.
We have moved from phase 1 of the project into phase 2.
And the push to define racism as a public health crisis.
I want all of you to join me in eradicating racial disparities. The shadow of racism is impinging on the rights of everyone to seek appropriate and adequate health care when needed.
Welcome to LTC News. I'm your host, Matt Nelson. In March, the Lowell School Department had to quickly adapt to a new normal of teaching in a pandemic. In this next segment, we speak with Superintendent Joel Boyd about the steps that they took to provide a learning experience for students in their homes and the possible paths to in-person learning this fall.
I wanted to start out first, just sort of ask you what has happened within the school department between the day that Governor Baker announced the initial lockdown and where we're at today, where things are starting to open up again.
If you recall, if I take you back to Governor Baker's announcement, which actually came on a Sunday, and it was the preceding Friday where in Lowell we made a determination that running school in person, given the way the pandemic and the health crisis was evolving, just was no longer going to be viable, while also keeping our community, our children, our staff, and our families safe. If you also recall, we announced that Friday, it was a 2-week closure that we had announced. And at that point, with announcing a 2-week closure, it was so unheard of that I'll tell you, I got kind of the 50-50 support and criticism that I tend to get when you close school for snow. It evolved so quickly, though, however, that then by that Sunday, the governor was closing schools, and now we look back on it and we kind of say it was inevitable. Now, because we were as planful as we were able to get food up and going for our families during the course of the closure, immediately having grab-and-go meals for our families, because remember, we think about schools as being educational institutions, but our schools serve so much more for our families. In addition, we completely redesigned our entire educational structure to be at home. Our teachers were teaching remotely. I was a teacher in the classroom. I taught science, and thinking about what it would mean to change from the labs that I used to do with my students physically and that I was really prepared to do, to changing to something that would be online and virtual essentially overnight. That's an extraordinary accomplishment on the part of our teachers to be able to do that. One thing that came up quite quickly, as I think many people might expect, is that with remote learning, you're required to have access and have technology. We identified a number of children who just simply didn't have technology at home to be able to connect to learning from home. So we were able to provide out over 5,000 Chromebooks, mobile devices to families, support families with internet connectivity, so that families could stay connected to their teachers, to their schools, to each other. By the end, within just a short amount of time, I wouldn't even say by the end, within just a very short amount of time, essentially every service we provide in the school district, we were providing remotely.
What does the fall look like for you guys right now?
There's 3 scenarios we're building towards. One would say, if there is some type of really meaningful, widespread treatment that can bring the alarm of COVID down to the level of the many viruses that are out there, which certainly doesn't seem to be in place right now, but at some point that'll be there. We're going to have a return to our full student body on campus, and we're planning for that possibility when it comes available. It's not going to be the same as last September. We've learned a lot. There's a lot of new health and safety guidelines out there that we're learning from, but we're planning for that possibility, and that's one scenario that'll likely come into play again when there's widespread, acceptable and meaningful and effective treatment, at least, if not a vaccine. Second scenario is what you're seeing happen across some other states, fortunately not here in Massachusetts, where you have a resurgence of these numbers. If we see that, or emerging with the flu season, we're also planning for that possibly so that we can improve upon a remote learning environment for our kids. We just purchased over $2 million of additional Chromebooks for our students to make sure we can provide for every student a Chromebook as if they have a textbook, for instance. Make sure we have everything available for our kids. Then the third, which seems to be the more likely scenario given the current circumstance of the pandemic, is that we have a combination of the two. A combination of in-school, in-person, and at-home remote learning. We're planning for all three of those scenarios because we know at any given time now, having gone through what we did in the spring, that we need to be ready to implement any one of those schooling models at any given time based on the circumstances that are surrounding us with this health crisis. There's two aspects of this. There's the physical safety, and then there's also the psychological safety. And making sure that not only are we providing and meeting all of the conditions that health officials suggest in terms of social distancing, personal protective equipment, cleaning, disinfecting, all of that stuff for our families when they come on site, but also making sure that our families feel like they're safe. So I do believe that within all of those models, we're going to have a need to make sure that we have options for families, that families can make decisions that are best for them. Each family is in a different position, and we want to make sure that we can meet our families where they are, because this is such an unheard of circumstance that we've really got. We try to value our family voice every step of the way in Lowell Public Schools, and I think we've got to emphasize that even more.
Anyone traveling into downtown Lowell from the connector is well aware that the Lord Overpass project has been very active this summer. We spoke with transportation engineer NATASHA VANCE for an update.
We have moved from phase one of the project into phase two. Phase one was the portion where the contractor worked on widening the ramps to allow for 2 lanes of traffic on the ramps going up and down to the overpass itself. And then in phase two, they closed down the underpass. And as I'm sure people have seen, it is currently being filled. And so they're installing drainage structures, installing utilities, underground utilities, and compacting the fill. And so I think people are getting the idea of what the final project will look like. It will essentially be like driving over a small hill. So you'll come up at the same grade as the ramps. Up at the top, there'll be traffic signals for Chelmsford and Appleton and for Middlesex Street, and then you'll continue back down at the same grade as the other ramp. We expect traffic to flow fairly similarly to how it does now. I think one thing to bear in mind is that there will be a new traffic signal that doesn't truly exist right now. So Jackson Street will be extended and Fletcher Street will be realigned so that they will meet and make up a new intersection that doesn't currently exist. So that's going to create a little bit of delay, and I'm talking in the 20-second range. So when people are traveling through this section, if you're in a single occupancy vehicle, you're going to experience 6 traffic signals, whereas before you would have experienced less if you were going in the underpass. However, the entire project will be a net improvement because there will be significantly better pedestrian accommodations, bicycle accommodations, and transit accommodations. So the project ultimately will have buffered, so meaning separated from traffic, bike paths and pedestrian paths, as well as 2 lanes, a busway that will run right down the center. That busway will be able to be used by emergency vehicles. So when fire trucks and ambulances and police are trying to get to an emergency, they'll be able to skip all of the traffic in the outer lanes and use those busways and get there quickly. That's something that our LPD and LFD really appreciate about this project. And then the busways will also keep the buses out of mixing with regular traffic. So right now, of course, they come out of Gallagher Terminal and they're in the lane, share the lanes with the cars. So now they'll have their own dedicated lane, which should help improve their bus service and improve visibility for people in cars because they won't be having to look around buses. It's such an important roadway for access to the downtown and access to Lowell and coming out of downtown going to the connector that they have to keep it open at all times. So there will be times where there might be detours, there might be times where a side road is closed and you have to go around, but the main section there will always be access through in both directions. I do think the pandemic helped us a little bit with a reduction in traffic volume, maybe making things go a little more smoothly. The project is on budget and on schedule. We anticipate it'll be complete in January of 2023, and we feel like the project is going really well.
On July 14th, before the City Council meeting featuring Mayor John Leahy's motion to declare racism a public health crisis in Lowell, the Diversity, Equity, and Inclusion Consortium held a rally at JFK Plaza. For 2 hours, residents and community leaders spoke about the experience and consequences of racism in the city. We bring you a small sample of what was said.
Are you guys excited to rally for change? Awesome. Awesome. I am a proud member of the DEI, which stands for Diversity, Equity, and Inclusion, because that's what we're trying to get done. It's all about all of us working together to get things done and recognizing the power of each and every voice.
I'm standing here today representing all my healthcare colleagues at Lowell Community Health Center. I joined Lowell Community Health Center in support of Mayor Leahy's motions 11.11 and 11.12, seeking the eradication of racial disparities in healthcare. I want all of you to join me in eradicating racial disparities. The shadow of racism is impinging on the rights of everyone to seek appropriate and adequate healthcare when needed.
The history here, right, that every group comes in, they face prejudice and discrimination, and then they rise to some level of political or economic power, except for the black and brown folks. That doesn't happen for us. I wonder why. So let's talk about that. Systemic racism. What does it mean? Do our local leaders even know? I'm asking for real. Do they? Do they really know what it is? Because I highly doubt it. Systemic and institutional racism impacts all of us, okay? In a racist society, it is not enough to be non-racist, we must be anti-racist, okay? Angela Davis said that. So it's not just our elected leaders, it's all of our leaders. Every single person who walks into a boardroom, every single person who is an executive director or a CEO, every single person who has some kind of decision-making power in this city has to analyze themselves, has to unpack their whiteness, has to unpack their privilege.
Yo vine aquí en el 92.
She came here to this town back in 1992.
Donde pasé la peor discriminación hacia mi familia en esta ciudad.
To my dismay is where I experienced firsthand the racism that this city had to offer, unfortunately.
En todos los lugares que iba no tenían intérprete, donde yo tenía que pasar mucho trabajo, empezando por la ciudad.
A lot of the offices, obviously, that she entered in order to get things done, she was turned back. She was turned away. Unfortunately, they very, very little interpreters to help her achieve what she wanted for her and her children as well.
I'm Emmanuel Wapo. I'm a rising senior at Lowell High, and I'm actually very tired of what's been going on in our school. Our expectations of the school system are met in the smallest degree in reality. The only thing actually working in the school system is protecting the few at the expense of the many. I am the many, and I'm tired of it, and you should be tired of it as well. I'm always told that it's up to our generation to change the mistakes of the past, yet that is false. If you want to get the intended behavior, moderate and model the best behavior. If you wanted LHS to be a #1 school, you should have acted like a #1 school.
And the bottom line is that racism hurts children in real and fundamental ways. It hurts not just their health, but their chances for a good and successful life. And these disparities are proven to increase their risk of health problems and probability of reduced overall life expectancy.
Lowell is racist. Lowell never knew. Lowell said assimilate. Lowell said I don't see color. Pray that you see me. See my skin in all its sun-kissed glory and call me the queen that I am. To bring about change, you must not be afraid to take the first step. We will fail when we fail to try. Rosa Parks. Racism is a public health crisis. Lowell Public Schools and Lowell Police Department has failed so many of our families and students. Let's not add this to the failure by deeming the voices of this city are not worthy to be listened to. Be the change. Thanks, y'all.
In this week's Sunspot, Lowell Sun Enterprise editor Chris Scott sits down with Lowell Community Health Center CEO Susan Levine.
Good evening, everyone, and thanks for tuning in to the latest edition of Sunspot. With me this week is Sue Levine, the Executive Director of the Lowell Community Health Center. We're talking the day after the City Council narrowly defeated 5-4, declaring racism a public health threat in the city of Lowell. Sue, I know that you were there at the rally beforehand in the JFK Plaza, and I know if it had been a traditional meeting, you probably would have been up in the balcony of the City Council chamber holding a big banner or something like that. Tell me, why you were so assertive and vocal last night, and why you think that the City Council missed the boat on this issue.
So as I have said in other forums, community health centers like ours were founded out of the civil rights movement. So it is absolutely core to our mission to address health disparities in our local communities and to address structural racism. And so we've been around for 50 years doing it. There's about 50 health centers in Massachusetts doing the same work. And I believe it's about 1,300 health centers across the nation. Mm-hmm. So we were founded out of the war on poverty, and our job was to bring healthcare to those who otherwise did not have access to care or conversely had barriers to care.
Tell me why, and again, I've just got to push it a little bit, why racism you feel in this city is prevalent that it should have been declared a public health threat by the City Council last night.
Right. So if you look at health outcomes across the board, and you look at who is doing well with their quality of care or their health outcomes, you will see dramatic disparities based on race, ethnicity, language access, and those are the exact type of interventions that we try to deploy here at the health center to close those gaps. Mm-hmm. And so if we look and see that a particular group has disparities within their health outcomes, we target interventions.
Mm-hmm. And tell me about the rally last night that you attended prior to the meeting. You must have found that to be uplifting. There were a lot of people there, were there not?
There were a lot. I'm so not good at counting, so I would love to know if someone got a number of the amount of people that were there. We had a good turnout despite some questionable weather. Mm-hmm. I am a member of the Diversity, Equity, and Inclusion Consortium of Lowell. Mm-hmm. So I went there as a member of DEI. I also went there as the CEO of Lowell Community Health Center to speak on behalf of the Declaration of Racism as a Public Health Crisis. Mm-hmm. Our board of directors, which this is important to note, community health centers across our nation, we are required to have that 51% of our board of directors are consumers or patients of our health center. Mm-hmm. Our board of directors took a unanimous vote earlier this month in support of the DEI letter, as well as declaring racism a public health crisis. And so I spoke to that at the rally.
The vote was 5-4, and you saw city councilors getting together with other city councilors. That normally doesn't happen, that there were some factions there last night. We don't need to get into all of that, but what do you think the next step is? I know DEI is not just throwing in the towel.
No.
And I know that there's a march planned for Saturday evening from the North Common concerning the police department and funding. What do you think is next?
So like any movement, again, I go back to health centers. We were founded out of the social justice movement. Our health center is 50 years old, but the social justice movement really took off about 70 years ago. It's a continued fight. It's a continued movement. It's really sad that it's taking decades for us to truly achieve equality and equity. So we're going to press on, and the health center will press on, and the DEI will press on, and we will find other avenues to help better inform and educate our broader community. And I always think about where people are on this notion of social justice as sort of this general understanding or education continuum. And what I watched last night is that there are some individuals that are further along in that continuum. And we have to help move others along in that continuum. I have to do that in my own family, in my own neighborhood. You know, I heard a great speaker on NPR say, the people you want to target in this effort for justice are the ones that have the lawn signs out. Right? So they've put the lawn signs out. So that means they're hearing, they're beginning to understand. Now get them to donate and act in other ways. So our target audience has to be those people who are movable and who want the education and the awareness. I got lots of wonderful calls from across the city, people, leaders asking me to help explain it to them. So what I think is next is trying to move more people along that continuum and to educate them and focus on the right people that can be moved.
How many folks have been tested at the community health center? How many positive tests? Can you just try to put it into some context?
Yep, I actually have those numbers. We have tested since the start of the pandemic 2,500 individuals. That's primarily patients, because as you recall, in the early pandemic, we weren't open to what's called community-wide testing. So of those, we had about 420 positive test results, which is about a 17%. Getting back to the first topic we chatted about, and I'll just give this one data point. Of all of those patients that we tested, 17% of them were Black or African American, but 29% tested positive. And so what that means, and then compare that to white counterparts, 43% were tested, but their positive rate was 33%. So this just is another data point that Black African Americans have been disproportionately impacted by the COVID pandemic.
And what about the number of employees who were tested at the
Well,
health center?
you know, thankfully, we have done really well on that front. And I think it's because back on March 13th, we pretty much emptied our building and moved to telehealth. And I thank Beth Hale, our Chief of Clinical Services, for helping us to make that decision. So we have tested 44 staff, and 9 of them are confirmed positives. And many of those 9 have recovered, and some are still in the early stages of COVID.
Have you been able to bring people back? Have the finances improved to, you know, resume some normalcy in the way the health center operates?
Yeah, well, as I've said many times, our furlough decision, like for all organizations across our country, are the most painful decisions. And so we did furlough 157 individuals. And on June 30th, we made a final recommendation to return 68 of those individuals. We were unable to return 89 people. And as a community health center that prides ourselves on hiring from within our community and supporting our community.
So 89 people no longer are employed at the health center.
Exactly.
Wow.
So in my message to them, because the world just changes like every day and we're asked to do new and different things. And so what I'm hopeful is that we will maintain their loyalty and their love for the health center, and that as new jobs become available, then they will apply and try to come back to the health center.
You mentioned telehealth, and it I think a lot of people are realizing what they can get done over the computer or over their phone. That really is the wave of the future, is it not?
Absolutely. And the first place where we have seen success is in the area of behavioral health and mental health. We are providing more access to care for patients who require behavioral health or mental health counseling, because telehealth is far more accessible. People are more comfortable in their homes. I have my own family members who are now using telehealth for behavioral health, and it's opened the world to them to feel safe doing it in their own home. And if you think about patients who have transportation issues or tough work schedules, telehealth is it's a game changer for behavioral health.
Now, City Hall announced today that it's reopening a partial schedule.
Right.
What about the health center? Will the health center return at some point for more public access? Where does that stand?
Yep. So we are following the governor's reopening plan to a T, and there's very specific guidelines for healthcare facilities, and we have to attest to certain requirements to make sure we're ready. And so we normally see about 1,000 patients a day, and I believe we're seeing nearly 250. So pre-COVID, 1,000 individuals would come into our building for an appointment. Currently, we're at about 250 people on site, but we're being very selective with the type of patient that comes on site. So it's the type of patient that really needs a physical exam where you can sort of touch the muscle or what have you. Anything that can be done by telehealth, we are encouraging that continues to be done.
How concerned are you that Massachusetts can continue the trend with positive numbers? And what advice do you have for people out there to keep themselves safe?
Well, first and foremost, I think our governor and the command center are doing an exceptional job. So number one, continue to follow the guidance of our governor and our command center. Two, everyone should be wearing a face mask, and that is to protect yourself and your loved ones. And I have a family member with a very serious chronic condition, and so for someone like me, I need to wear a mask in front of that person, because I could, if I'm asymptomatic, perhaps I could potentially get that person sick. So please, everyone, wear your masks. And three, how will this play out in Massachusetts? I don't know. If we do the right thing here with the mask wearing, following the guidelines, and we increase testing, I'm hopeful, though there's no way I could predict. I'm not an infectious disease doctor, but I'm hopeful that we can continue to stay on a good path.
And that about does it for this edition of LTC News. You can find us on LTC channels 8, 95, and 99, online at ltc.org, on Roku in the LTC News playlist, on Facebook at LTC Lowell, or on our YouTube page. We leave you now with an excerpt of the Lowell Philharmonic Orchestra's More Than Self concert. I'm your host, Matt Nelson. Thanks for joining us.